Hi, I'm Dr. Tim Maggs. Welcome to the structural fingerprint exam. Structural fingerprint exam is an examination that finds hidden biomechanical imbalances and, if corrected before activity, will help to prevent injuries. And Lord, does our society need it. Now, what is the structural fingerprint exam and what are biomechanical imbalances? Here we have a graphic of what we call actuary Alex. Alex represents both the male and female population. However, actuary is a word that basically says these imbalances that Alex is demonstrating here, from the collapsed feet, the increased Q angle of the knee, the unlevel femoral heads, the imbalance in the low back, and we call the neck the fifth floor of an imbalanced building, and it will compensate to provide balance with all of the other imbalanced components of the body. So there will be a cost associated with these imbalances, and we want to let the world know we can identify these imbalances before the break occurs. So obviously we want to start with youth athletes, but it applies all the way up to the elderly in this country, because there are many things that can be done proactively in an effort to get the body to work more symmetrically and to work the way it's intended. Because most of us want to stay active into our later years, but we take the imbalanced body that God gave us and we never make any corrections to it, and we pay the price because we prematurely start to break down. And as we get older, all of us want to get more active, and that adds to the breakdown that occurs. So it all starts with the feet. Our research has shown every human has varying degrees of collapse of the feet, so we start with orthotics because we've got to create symmetry in the foundation. If you look at actuary Alex, that's where that imbalance is occurring due to the weight distribution imbalance. So we want to start at the feet and we want to correct them so that we can at least know that they are doing their job. As part of the examination, we also take this x-ray to look at the difference in the height of your hips. Now, we're going to be going over the different measurements that we do talk about that are part of the examination, the relevance they have to your life, the relevance they have to your diagnosis and what you're experiencing now. Because the one thing I know, once you hit the age of 30, everyone has the beginning of some problem, some worse than others. 40, a guarantee. 50, they should be signing up and giving away half of their salary to try to get back what they've lost already. So it applies to everyone. We're born asymmetrical. Those asymmetries magnify as time goes on. The traditional approach is we wait till we're hurt. We call our primary. Our primary knows it's outside of their field, so they refer you to the orthopedist. The orthopedist, whether you know it or not, has a very, very limited scope of practice. And that's diagnostically and therapeutically. If it's outside his or her scope of practice, they refer you to the physical therapist, and the physical therapist will do exercises or whatever they determine is needed. But none of those three understand actuary Alex, and that's where it has to get to. Somebody has to determine what your biomechanics look like and how to make those modifications and corrections before you're injured or even after you're injured so that you don't get injured next time. But you've got to take a new look at this whole thing, because in the end you're going to pay, and they say you pay now or you pay later with interest. Stay tuned for our next spot.